In this video, I'll be speaking to Sarina, who's a pharmacist at the Medical Cannabis Clinic. She's going to be helping you to understand what type of conditions qualify for medicinal cannabis, how to get a prescription and what the costs are, and also what type of cannabis products are available. So I do hope you like this video. If you do, please be sure to give it a thumbs up and hit the subscribe button so you can learn, live and share your CBD journey with me. Let's get into the video. Hi Sarina, thanks for joining us today. Really appreciate it. What position do you hold there at the Medical Cannabis Clinic?
Hi, thanks for having me, Rachel. So yes, I'm actually a medical science liaison and a prescribing pharmacist. So I'm a healthcare professional that sort of works in the medical cannabis industry. So my role essentially is liaising with a lot of doctors, consultants to sort of get them on board and provide more educational material for them in the medical cannabis industry. So of course, at the moment, medical cannabis is not something that's readily available on the NHS. So a lot of doctors do want to help treat their patients and they just need the correct guidance. So we essentially put them on a correct training course and get them up to speed with everything.
So what type of conditions are treated with medicinal cannabis here in the UK? I know that obviously we're not allowed to say that cannabis is going to cure anything. There isn't any, the scientific evidence isn't there as of yet. But currently, what type of conditions do you see people coming to you to treat?
So yes, just as you said, we don't use it to cure anything. A lot of our patients take it for symptomatic relief for a variety of conditions. So pain-related disorders. I mean, we have patients who have different arthritic conditions, so osteoarthritis, rheumatoid arthritis, different pain disorders. There's a lot of pediatric patients we have neurological disorders such as epilepsy, things like gastroenterology, and even palliative care and psychiatric disorders. So things such as chronic pain, as I mentioned, depression, anxiety. So there is quite a variety of clinical conditions that our doctors use medical cannabis to help all of our patients. But yes, as you said, there's no cure. And also there is limited evidence at the moment. One of the main organisations, which is NICE, so the National Institute of Clinical Excellence, they are the body who actually distribute guidelines for different indications and for a variety of diseases. There isn't that much information from NICE at the moment because we do still need to go through a lot more trials and a lot more evidence-based data.
So if somebody watching this has one of these conditions that you've spoken about, what's the procedure for them to actually apply for a prescription?
So as mentioned, of course, there isn't as much evidence for medical cannabis treatment at the moment. However, there will be more in future. That's why medical cannabis, it is actually an unlicensed medicine. So what that means is most patients for any condition, not just something that requires medical cannabis, whether you have heart conditions or whether you're going for normal treatment to your doctor, you always have to have conventional pharmacological treatment first. So licensed products must always be tried first for any medical condition. That's just UK normal guidelines essentially. So if you suffer from any of the conditions mentioned earlier and you feel you may be able to benefit from medical cannabis, we would always say it would only be on a case-by-case situation. Of course, we can't guarantee that a clinician will prescribe anything. That's at their doctor's discretion. But you have to have tried certain prescription medication first because medical cannabis would be a last resort. It's not first-line treatment.
Right, so it's a last resort. So if you've been to the doctors and you've been prescribed various different pharmaceutical drugs and you found that you're wanting something different, then you may be able to get medicinal cannabis on prescription.
Yeah, so like I said, it would be an individual assessment, and 9 times out of 10, most of our patients have been under consultant supervision, they've been under specialist care, and they've even discussed medical cannabis options with their GP. And a lot of the time, our prescribers, who are obviously specialist doctors, they're not GPs, we actually liaise with the patient's GP quite often, just to make sure we're getting the correct information, we're providing a correct treatment plan, so everything is done.
So if somebody then had been to the doctors, they were able to, be prescribed medical cannabis, what sort of costs are they looking at to, if they have a consultation with yourselves, what are the costs involved?
So at Medical Cannabis Clinics, there's 3 types of costs. So an initial consultation, at the moment, it's £70. It is usually £150. And then when you have a follow-up consultation, that's slightly reduced, that's £65. And when you have a repeat prescription, so for example, if you are a patient who has been stabilised on your treatment and you just require more, it's a £30 charge for a repeat prescription. But at all these consultations, there is no guarantee that a prescription will be provided. It is all after a thorough consultation, and we make sure we always have a consultation with the patient, even if you are stabilised on your treatment. It's just so we can just keep an extra eye on things.
What type of cannabis products do you provide then? So if somebody goes through this application, they do get a prescription, what type of products do they have access to?
So we have our own product formulary, for example. So there is a variety of different products at different strengths, but the main 2 categories are a flower-based product and an oil-based product. So it's all dependent on the medical condition itself, the symptoms the patient is suffering, which clinical indication we are treating. So it's on a variety of conditions, but we do recommend only flower or oil. With our flower products especially, we never recommend our patients to smoke, only to vape our flower products.
So that would be to use like a pen that would vaporise the flower. It's a cleaner method of consuming cannabis, isn't it, rather than smoking it alongside tobacco or something like that, which isn't very good for the health. And then an oil would be something that they would drip under the tongue and use it that way, like a sublingual oil.
Yes, perfect. So the reason vaping is recommended more is because there's a certain temperature you have to sort of vape the product at, and our clinicians will always make sure they explain to you which are the more effective vaping devices, where you can purchase them from, etc. It is just better for yourself, and it's better efficacy of the product as well. Of course, not every condition will be treated or recommended with a flower and a vape product. Some clinicians may feel an oil, like a sublingual oil that you put a few drops under the tongue, will be more clinically appropriate. So we will always put the patient first, and we always do what we think is best for the patient.
And this is why I really like the fact that we now have medical cannabis clinics, because each individual patient is different. The symptoms are different, and having that one-to-one consultation means that doctor can prescribe what's going to be right for that individual person, so they get the best effect from it.
Exactly. End of the day, our main goal is to always put the patient first, and to try and treat the condition or the symptoms for symptomatic relief, and in the hope that it can actually help a patient.
So I know that there are a lot of people in the UK that will be using medicinal cannabis, but they'll be getting it from the black market. So why would somebody choose to come to you as a clinic as opposed to just buying it from the street? What's the benefits from getting it from a clinic?
So first of all, obviously it's legal. Medical cannabis became legalized in November 2018 for medicinal use. In addition to that, because it's a legal product, we have regulations, we have manufacturers and actually authorized suppliers who supply our products. You know more about what's actually going into your product, and you're not getting what could be a dangerous mix on the black market, because you just don't know what is actually in your cannabis. Is it cannabis? Is it how much THC is in there? How much CBD is in there? There's a variety of concerns sometimes on the black market, and I understand sometimes some patients do go on the get products off the black market because of the cost and things like that. But one of the benefits of the medical cannabis clinics is that we actually have a joint collaboration with a campaign called Project 21, which is also known as T21. So we actually have where patients can get our products at a reduced price if they fill that criteria. So obviously there is a criteria depending on your medical condition, etc., and then it reduces the cost for that patient, so it makes it more affordable. Therefore, we can actually provide medical treatment to a variety of patients, because there is a misconception that if it's a private service, it's expensive, it's only targeting a certain type of clientele. That's not the case. We want to obviously put all of our patients first and ensure everyone can have access to help their medical condition.
So obviously if somebody was to be stopped by the police and they had a prescription from yourselves, it would mean that they wouldn't actually face going to jail, or they wouldn't be criminalised for it because they've got a prescription to show that they're legally allowed to have access to this cannabis.
So for the cannabis, I can't promise they wouldn't be criminalised because I don't know the situation at the time. However, for the purpose of cannabis, yes, we actually have a really good partnership with a company called Medical ID, which help us in terms of providing identification and documentation that this patient is under the care of a clinician and is being prescribed medical cannabis. So yes.
So how, if people are interested in speaking to yourselves and seeing if they do qualify to get medicinal cannabis, how can they get in contact with you? What's the next steps for them?
We have a variety of social media channels, but the first step I'd say is just reach out to us on our website. You can book a consultation, you can speak to a clinician, etc. So obviously we have the Medical Cannabis Clinics website. We also have our social media channels, so we have things like Facebook groups where patients can actually speak to each other. So once you are a patient with us, and if you require extra support afterwards, we do have a Facebook group that you can enter. But if you are just getting started, I'd say the best thing to do is just go onto our website and book a consultation.
So thank you so much, Sarina, for joining us today. It's been really useful having you come on and just explain exactly what people need to do if they want to get prescribed medicinal cannabis. And hopefully our viewers will be able to contact you and to get some legal and safe cannabis products.
Oh, you're most welcome. But yes, as mentioned, we're always here to help our patients, and we always work in partnership with doctors, consultants, GPs, just to make sure you get the best treatment and the best service possible. So feel free to get in touch with us anytime.
So we've just been talking about high THC medicinal cannabis. Obviously medicinal cannabis, when it's got high THC, it is going to cause a psychoactive effect, a stoned feeling. If you are looking to just use cannabis and you don't want that psychoactive effect, you can just use CBD oils, which you can get from my website. If you want to learn more about CBD oils, you can watch this video here, Best CBD Oils for Beginners. And I'll look forward to seeing you next time. Thanks for watching.